Residents of Ontario still cannot pay for private cancer treatment, but they can go to a new private clinic that helps patients cope with cancer while still offering treatment through the public system. But it is the line between public and private health care. Is it being blurred? Dr. Hamera Khan and the President and CEO of Medicor Cancer Centre, and Dr. Akbar Khan is the Medical Director. Welcome. Thank you for joining us. Now, I have to tell our audience you're a married couple, hence the similarity of the names. But tell us about your clinic and what you're going to be offering.
Well, it's very exciting to be here to talk about this new innovative clinic that we've just opened up. What we're trying to do is basically address a big gap which exists in the public system. And when I talk about this gap, it's based on the needs of cancer patients. So it's not something that a healthcare provider says exists or that a policymaker says exists. There are credible sources of information out there, like the Canadian Cancer Society, which surveyed patients in Ontario and found that they feel that there's not enough support. They don't find the information that they're looking for, and there's no one person who puts the pieces of their care together for them. So we've based this clinic obviously on findings of that report, as well as the experiences of the medical director, Dr. Khan, who's been doing this for over 10 years. So what we're providing basically is all kinds of services that revolve around a cancer patient to complete their whole person care. And that includes medical treatments, adjustments of their pain medication. If it's 2 in the morning and they're vomiting and they don't know who to call, well, they will call their medical or personal physician. And the other an interesting thing which we're doing is we're not just looking at conventional medical treatments, we're combining that with naturopathic treatments, because more and more evidence is coming forward that these treatments do help patients. So we're trying to put this holistic care plan for them.
How did you get to this point? Why are you providing this sort of a clinic?
I think I'd be better to answer that. I've basically been doing this type of care for the last 10 to 12 years. I've co-founded a palliative care team which works in Scarborough to look after basically late-stage cancer patients in their own homes. I work with another physician to provide this service, and we've found over the years that patients have continued to request certain things which we have been struggling to provide under OHIP, and based on my findings over the last 10 years in practice, we have decided that it's time to move forward with something innovative and try to help patients meet their needs and fill in these gaps in the system. So it's really based on patient requests and my experience.
Now, it's a big step in Canada. Obviously, private has its whole stigma around it in this country. And there are legal issues as well. Did you have to get legal counsel, and what were the hurdles that you felt that you had to deal with when you made this decision?
That was the first thing that we did, was we got 2 health expert lawyers to review our proposition, and we basically worked out a very, very legal way to provide private care for these cancer patients. And essentially the way it works is we are not charging for any medically necessary or any insured services. And the way the laws work in Ontario and the Canada Health Act, as long as you're not charging for insured services or giving preferential access to a physician based on ability to pay, it's legal.
What has the response been from within the medical community? What I'm sensing here is perhaps there is room for conflict down the road. Perhaps you offer to provide a certain level of care or some treatment that perhaps the oncologist involved personally with that patient might not recommend.
Well, our whole goal is to work with all the healthcare providers that a patient has. So we've already communicated with a lot of oncologists, and in fact, it will help their care, which means that when a patient goes to an oncologist, if they only have 5 or 10 minutes to spend with them, all they have to do is tell them the treatment, and we will explain all the side effects, how to deal with them, and what are the other possibilities of treatment. So it actually expedites and makes the care of the oncologist more complete and more efficient.
Has the response from the community been strong, been very supportive from nurses, doctors across the board?
People who know us have been very, very supportive of this, and Dr. Khan works at Scarborough Hospital, where most of the physicians are very keen about this idea.
Now, tell us, were there personal experiences that led you to this point where you just saw what was happening with your patients and you sensed that there was a need for this?
I think
that's basically what happened is there's been ongoing frustration both on my end and on the patient's end with the present healthcare system. And it just peaked last year, and I just said enough is enough. we need to do something more for our patients because I'm just not able to continue to provide what the patients are requesting.
Can you be a bit more specific? Can you tell us what kind of things you're thinking of?
Well, the things that were happening where my patients were starting to say, I want to go to the States and spend God knows how much, $5,000 a week on some unproven treatment. And my response is, no, wait, let me research that for you. And this type of thing is not funded under OHIP. And I've been doing this work for the last 10 years, basically for free. And I couldn't do it anymore, and my patients need more than what I can provide under OHIP.
Now, no matter how legally sound this operation might be, you will be facing criticism probably from a lot of people out there. How are you going to respond to those critics? Both from the medical community, and there might even be, I sense, probably a little political backlash. Healthcare, universal healthcare is part of the Canadian system. It's part of the Canadian psyche.
Well, I think there's always going to be critics. And what you have to understand is, at the end of the day, it's not the critics. It's the patients and their needs. And the policymakers can say whatever you want. The healthcare providers can say whatever they want. But if the patient needs the service, they should get the service. And that's what we're going to do. And basically, there's not much criticism when you talk about the care of a whole person. Would you tell a cancer patient that because of the policy or because of what a political party is saying, you should not be able to get the care?
So it sounds like what you're saying is that you are, in a way, going to become medical advocates for people, because when you find out that you've got a horrible disease like that, it's a surreal experience to go through, and your thinking isn't too clear, and it's a whole new world that you suddenly have to be an expert in.
Absolutely.
And so do you sort of see yourselves as being someone who can provide just expertise as to the kind of alternatives they have?
Patient advocacy is a major part of what I will be doing in the clinic. And I think you really need a physician, and ideally a family physician, to take on that role for the patient, because family physicians are trained in holistic or whole person care.
Well, it sounds like what you have here, even though you have a center, it sounds like a mobile operation. Is this something where you are going to be able to, somebody will be able to ring you or BlackBerry you or Palm Trio, whatever, and you pick up and you go meet that patient in whatever hospital they might be in and walk them through the next step? Is that what you'll be doing, or is it all center-based?
If that's necessary, we may be doing that in the future. Right now, it's planned to be done as an outpatient in the clinic itself. We've been trying to work on a model for home-based care as well, because that's the kind of care that I'm doing right now. But where these are evolving, we're thinking of different ways.
How big is the operation right now? How many people will you have on staff serving patients?
We have 7 people on staff who are going to be doing actual patient care. And then in addition to that, of course, we have a pharmacist who's going to be available, and obviously the computer technicians, because a big part of our clinic is the innovation in the patient electronic health records.
Now tell us about monitoring. How is the government going to monitor what you're doing? What are you going to be subject to?
I think that's up to the government to tell us.
They haven't done that yet?
They have not done that
Now, you've
yet.
got a little gadget in your hand. What do you want to show us?
I just wanted to show you this electronic health record that we've pioneered for the patients. Every patient that comes for consultation will get this, and if they stay with us, they will get ongoing updates of this device. And what this is it's a PDA that contains the complete health history.
Turn it around, the camera can see you. Yeah.
And on there we put all their past medical history, their cancer history, the specifics of the treatments, all their medications, their allergies, and we even include, if they're interested in that, living will and advanced directives, and a list of their complementary therapies. So the patient carries this wherever they go, and that way every single member of their healthcare team has access to that information. Presently in the system, that does not exist. There is no way to automatically interconnect all their information, be it lab tests, imaging studies, whatever.
Unless you're at one hospital.
Exactly.
Yeah.
Within the one hospital, everything's fine. But once a patient goes back to their family physician or to a different hospital, or if they're in an ambulance, well, that information is simply not available.
Okay.
For us, in an emergency situation, even the ambulance, the paramedics can access this information.
All right. Well, thank you both for joining us today.
Thank you very much.
Thank you very much.
Okay. That was Drs. Humaira Akbar Khan from the Medicare Cancer Center. Stay with us. Our play of the day is next.